One of the things that is very impressive to me about IOF is the commitment to education, particularly exposure to residents and fellows, and I was able to get a stipend to attend that course, and it was really well done with cadavers, able to utilize and practice the technical skills using ultrasound and fluoroscopy.
What IOF does that's different than other courses is focuses on regenerative types of procedures in terms of injection techniques that aren't really taught at other courses, injecting tissue targets that are uncommon, and also combining ultrasound and fluoroscopy, which a lot of courses don't do.
You can focus just on the shoulder and really get in detail as to how to perform appropriate and accurate shoulder injections and knee injections, hip injections, etc. And so each program, each course is very specific and focused, so you can progress through level 1, 2, and 3, so you can master that joint and not rush and try to learn everything at once, because that's impossible.
So I learned several different things. I learned techniques in fluoroscopy and ultrasound for harvesting bone marrow from iliac crest. Also included in that course is a stem cell counting component, which is very interesting, bringing in some of the basic science. And at least even if that's not practiced every day by physicians themselves, it was very helpful to see how that's done and the importance of understanding the concentrations of the different cell types and how that impacts the outcome of the procedures.
The way the IOF courses are set up are really cool because, first of all, I get videos at home, and that's just right in my wheelhouse because I like coming into these courses with a knowledge base and ready to go. The instructors are excellent. The knowledge that they have just with ultrasound, the protocols necessary to do these procedures. They're long, they're intense, but you leave with a really kind of new set of skills that you can literally take to your practice the next day and implement them.
I thought they were fantastic. Very hands-on teaching. I actually like the rigorousness of the course and the requirement that each attendee be required to prove their expertise, both during and at the end of the course. And I found it very different from some other regenerative medicine courses that I've gone to, where nobody really seemed to care if you picked it up or not, and it seemed very random in terms of the amount of instructional time that you got. So I would say that in my experience, this was a far superior course attending the IOF trainings.
I think the Interventional Orthopedics Foundation has the best course for biologics because you get multiple experts to teach at once on live cadavers. The courses are extremely beneficial for the hands-on practice, to share our knowledge with other providers so that we can all elevate our standard of care to take care of people.